one of the things that we can see from our own statistics is that those with mental ill health are underreported amongst our own learner cohort. So from 5,000 learners, we can see from the proportion that have declared mental ill health is much too low. If there's 1 in 4 that have actually got a diagnosis. So if there's 1 in 4 with an actual diagnosis, and we know that there are people that have not been to a doctor that would have got a diagnosis, that makes it an even higher proportion of the learners that come here that don't declare. So we're looking at ways in which we can...
And for example, we also
get people to disclose.
Yes. It's part of the project.
And it's part of doing these wider activities, so it's less of a stigma, and people see actually there's an advantage to disclosing.
But we also targeting ESOL learners. We've got a few courses specifically targeting our ESOL learners, and that's proving a challenge more than anticipated, because the learners are not coming forward. They're saying, no, I don't have a mental problem, and that's it. So it's we're going to have to revisit the classes to try and push the program.
So it's made us develop new ideas and new schemes because of how we can sustain this longer term with other activities. So it becomes part of your whole learning community. Others should participate, not just adults with mental ill health. And
it certainly made us think about our own enrolment form, for example. When people declare any additional support, and we have a box halfway in the middle saying mental health, and that is rarely ticked, and one of the reasons is because it's in the wrong position.
We've always known that learners have benefited in terms of health and well-being, but what we've never done is linked it in to how it's supported people with this diagnosis of mild to moderate ill health. Feedback from that course was tremendous, what they had gained. And what they were all saying is, I wish we'd had this sort of programme earlier. Wish it had been available to me. And that's just a 5-week programme, 2 hours a week, where people could really explore what assertiveness means, being listened to, how you can make changes which will improve your life and how you feel about your life and your life chances. It was incredibly powerful to listen to them. So it has definitely improved access, has been valuable from that point of view. Now we're starting to gather that evidence, and in terms of future sustainability, we are going to build it into our core programme now. We will do less of other things so that we can make space to deliver this programme from our community learning grant.